Hello, friends, welcome back. Today, we are going to talk about how to bring healthcare to patients' doorsteps, especially for people living in remote, hilly areas. Let's say that we are making this solution for million plus people in remote northeast region of India. Data clearly shows that low respiratory infections as well as diarrhea are main cause of lost life. This can be dealt with 100% adherence to vaccination. Data also claims that major attribute is malnutrition, which comes under the top 10 risk. To help address majority of the cases, we selected pregnant women and young child in age group of 0 to 5 years as our focus group. In hilly areas, there are a lot of tasks to be done by women on daily basis. Preventive health risk issues take a backseat as there is already so much on the plate that needs to be completed. Then, traveling up and down further increases the hesitancy for any preventive checkup or vaccination unless and until it is really required. From realizing that vaccination is required to finally making a trip to the hospital, there are many pain areas that we notice in patients' journey framework. We wanted to address all of them. There was also a lack of awareness on health benefits and curiosity on what help patients can demand to get better. Let's understand the region. There is one hospital usually among 25 to 30 villages. Distance to hospital needs to be covered in these unwinding roads. Well, you are lucky if you find a smooth road from your house in remote village to your hospital. We also notice the presence of post office in each village and its proximity to every house due to central location. Current travel time up and down to the hospital is 2 days. This itself is a hindrance for any preventive health checkup as well as general consultation on hygiene and childcare. Let's understand what is our objective again. We took upon ourselves an aim of improving the healthcare services and bringing healthcare to patients' doorsteps. Also, if we can target to remove the hesitancy for preventive healthcare and enable improvement in state mortality rate. How can we do that? We can focus on vaccination, health card registration, food package distribution. We thought of iterative approach to implement this solution. Solution components added to post office in each iteration. In iteration 1, solar refrigerator and mobile. In iteration 2, drone, biometric and food package were added. In iteration 3, we further added robotic kiosk. Let's talk about it in more detail now. In iteration 1, we focus on reducing the patient travel time to just 10 minutes one way. That means it is to and fro just 20 minutes. Here, hospital loads the vaccine in solar refrigerator that is carried by the van to post office in remote areas. Compounder gives the vaccine shot to pregnant women and also facilitates online doctor consulting with base hospital. Woman happily walks back home, a 10-minute walk. Feedback of this iteration revealed some insights and we thought of addressing this in our next iteration. In iteration 2, we introduced drones and reduced the vaccine delivery time to just 30 minutes. We also introduced health card registration and pre-packaged nutritious food linked to government food grain program. So, drone delivers a vaccine to the village in just 30 minutes. Biometric is given to the woman for health card registration and we link it to food package, food grain, so to incentivize the vaccination. As you can see, drones reduce the vaccine travel time drastically by 97% and ensured steady supply of vaccine for preventive healthcare measures. If this benefit is extended to all villages, it is quite a substantial improvement in services for all involved. We again received some feedback in iteration 2 and we thought of improving the same in iteration 3 of our implementation. In iteration 3, we thought of further improvising our solution to patient doorstep as well as introducing a fully digital solution with Robotic Kiosk. We introduced a process in which a sick patient can put a red flag outside the house. Postman can directly go to patient's home and enable the consulting on online platform. Postman can also deliver vaccines directly to the home. Meanwhile, in the post office, self-help robotic kiosk gives privacy to its customers in online doctor consulting, as well as delivery of all the benefits. These are the key features of robotic kiosk. Online consultation with doctor in full privacy, health card fulfillment request and availability of benefit details at the fingertip of patient when the patient wants. Patient can also watch video on hygiene and childcare, collect prescription and purchase standard non-prescription medicine. This kiosk also dispenses nutritious food packets as per the entitlement linked to food grain program. Utilizing existing post office infrastructure sounded promising as it would do away with upfront investment in infrastructure cost. Also, we can embed other solutions like clean energy solutions to power the post office as well as enhance the rooftop to land the drones safely. We thought of repurposing the post office and add features as robotics kiosk as well as solar refrigerator box as our key solution elements. To reduce the travel time as well as human dependency on transport, we thought of introducing drones. We are all excited about this transformation idea of using post office as central theme for our phased implementation. Do let us know how you feel about this implementation program delivering healthcare to patients' doorstep in hilly areas. We will be happy to hear from you. Thanks for watching.